Here's what's been happening lately. 3 things. First, Illinois lawmakers are pushing legislation to crack down on junk fees and bots in online ticket sales. Next, Illinois has seen a dramatic drop in opioid overdose deaths. And lastly, Illinois public school enrollment has dropped to the 4th worst in the US. Let's break it all down. First, the ticket price you first see will be the price you pay in Illinois under legislation signed Thursday by Governor J.B. Pritzker, banning so-called junk fees that often jack up costs for concerts, hotel reservations, food orders, and other online purchases. The new pricing provision is part of a slate of consumer protection measures passed by the Illinois General Assembly last month, also targeting bots and ghost ticketers that scoop up coveted tickets for resale at exorbitant rates. The junk fee law, championed by State Representative Bob Morgan, Democrat of Deerfield, and State Senator Omar Aquino, Democrat of Chicago, bars companies from advertising prices that don't include servicing, processing, or convenience fees and other surcharges that get tacked on to the final cost. Delivery and rideshare platforms have to itemize all costs and fees before the last stage of buying, while rental sites have to disclose resort fees and other add-ons upfront. A Consumer Reports analysis found that an average family of 4 can lose about $3,200 a year on junk fees. Separate measures signed by Pritzker outlaw the use of bots to cut online queues for tickets to corner the market on valuable tickets, and require resellers to have tickets in their actual possession before putting them on the market. Another law will require buy now, pay later lenders to register with the Illinois Department of Financial and Professional Regulation, clamping down on an industry that has operated like the Wild West, according to State Senator Michael Hastings, Democrat of Frankfort. Lenders have until 2028 to comply with the law. The junk fee and bot laws take effect January 1, 2027. Next, a new report titled Pain in the Nation, the Epidemics of Alcohol, Drug, and Suicide Deaths, details the drastic decrease in opioid overdose deaths from 2023 to 2024, the most recent available data. These deaths decreased by 36% in Illinois. Deaths tied to highly potent synthetic opioids, which include fentanyl, decreased even more, by 38% across the state. Separately, Cook County and Chicago reported a major drop in opioid-related deaths, plummeting 37% from 2023 to 2024, according to the new data from the Cook County Department of Public Health. Both national categories also saw a 10% decrease in opioid overdose deaths in the previous year, between 2022 and 2023. Illinois also saw suicides drop by 9%, the report found, but alcohol-induced deaths increased slightly by about 3% during the time period. Overall, Illinois saw an 18% decrease in the number of deaths tied to alcohol, drug, and suicide. Nationally, that combined rate fell by 16%. It's the first time there's been a significant decrease across the combined 3 metrics since the Centers for Disease Control and Prevention started to collect this data in the late 1990s. And lastly, Illinois public schools are losing students at a faster rate than in nearly every other state. From fall 2014 to fall 2024, public elementary and secondary school enrollment dropped 10% in Illinois, according to a recently released report by the National Center for Education Statistics. The national decline was 2%. Public school enrollment is falling across much of the country, but some states are losing students at a far faster rate than others. Illinois ranked 4th worst in the nation for enrollment loss percentage in the period, behind only West Virginia, Mississippi, and New Hampshire. At least some of the drop can almost certainly be attributed to Illinois' ongoing out-migration problem. Just over half of the state's 3rd through 8th grade students were proficient in reading and only 39% were proficient in math, on 2025 assessments, according to Illinois State Board of Education. Also, 1 in 4 Illinois students are chronically absent. Schools are not only struggling to retain students, but also to engage the students already enrolled.